On the Medical Watch, preventing COVID-19.
Yeah, Dana Baer now with more on a critical study.
For months, we've been talking about convalescent plasma, using immune-boosting antibodies taken from a donor who has recovered from COVID-19 and given to a patient still suffering with the infection. Many hospitalized patients have received the treatment, but can it help those before symptoms set in? Now, there's a nationwide push to put the plasma to the test. It's this yellow liquid that holds the gold. Antibodies live in a part of the blood called plasma.
These antibodies are proteins that can glom onto the virus and mark it for destruction and prevent the virus from multiplying.
It's harvested through the same process as a blood donation. Not every COVID-19 survivor has what's known as high-titer antibodies, but about 70 to 80% do.
We want to make sure that we have what we call high-octane antibodies. So we want to use plasma from people that mounted a good, strong response to COVID-19 to help protect patients who will receive these transfusions.
Convalescent plasma studies done in hospitalized patients have shown promise.
There has been a large study out of the Mayo Clinic. Over 70,000 patients received convalescent plasma in the hospitalized setting, and it was shown to have potential benefit, and that benefit outweighed the risks. But what we're doing is we're looking at the use of convalescent plasma to treat people who are still at home, people who are not in the hospital.
North Shore University Health System immunologist Dr. Giselle Mosnaim and her colleagues are looking at two different groups. The first, high-risk exposures. That's people who've been exposed to the virus through a close contact.
You don't have symptoms yet, you don't have a positive test. We can give you convalescent plasma to prevent infection.
The second group, patients who've tested positive and have had symptoms for no more than 8 days.
We can give convalescent plasma to prevent hospitalization, prevent worsening of symptoms.
Patients in the study will receive a 1-cup infusion, either plasma or placebo. That takes about an hour. After, they'll be monitored for any immediate reactions. And as the COVID-19 vaccine makes its way to healthcare workers this week, Dr. Mosnaim says convalescent plasma has a more immediate benefit.
For a vaccine, the current vaccines that we're talking about, you have to get 2 doses, either 21 or 28 days apart, and you really have to wait a week or 2 after the second dose for immunity to be optimized. So really, with the convalescent plasma, you're getting that immunity immediately, same day. And we all want to get back to a normal functioning society, and this is an opportunity for all of us to work together toward that goal.
You can learn more about the study, including how to donate plasma, on our website. We have a link. Back to you.
It is time for Tom at 10. Hello, Tom.